You find that stuffy nose continues beyond allergy season? Sometimes it leads to sinus infection, or you always have trouble breathing. Your nostrils just feel clogged. Well, if that's your issue, what can be done to permanently fix this problem? Joining me is Dr. Collin Chen. He is a SLUCARE facial plastic and reconstructive surgeon. Good morning, doctor.
Good morning. Thanks for having me back, John.
Yeah, it's a pleasure. Hey, so when should somebody think about having some rhinoplasty, actually going in and doing what you do so that they can breathe better?
Well, I think that we have to first get down to what is the cause of your nasal breathing issues. And nasal airway obstruction is a complex topic to understand, but I think it's helpful if you think about it similar to something we're all very familiar with in St. Louis, and that is the traffic. Now, I know you guys cover the traffic very nicely with the Sky Fox and the Roadrunner, so you know if there's a snowstorm coming, we expect all lanes of Highway 40 to be affected, eastbound, westbound, and there's going to be a generalized slowdown everywhere. And that's kind of like what happens in your nose during allergy season. There's swelling throughout, and you could feel clogged up on both sides of your nose. Oftentimes, the treatment for that is the right nasal medical regimen, or perhaps you need to be allergy tested to get you on the right allergy treatment to get that swelling to calm down. Now, on the other hand, if you have just an accident blocking off one lane of Highway 40, and we've all seen this before, during rush hour, traffic can get backed up for miles just from that one lane. And that's kind of like what's happening inside your nose. If you have a deviated septum, or perhaps you have a crooked nose, just that one side of obstruction can really slow down airflow for you during the times that you really need it, your rush hour, like maybe during exercise, maybe when you're trying to sleep, or if you use a CPAP machine. So if that's the case, those accidents and those obstructions don't just clear themselves out of the way. Oftentimes we need to come through and talk to you about the right surgical plan to straighten things out and to get things back where they belong.
Yeah, sometimes it can be something like my sister Janie, when she was a little girl, she put a little chicken bone up her nose. And for years, it's a true story, for years she walked around, she couldn't breathe, and one day a doctor like you back in the 70s went up there and said, oh my gosh, it's a chicken bone. And she could breathe again. I mean, you never know.
You're right. You never know. And the thing about that is you bring up a good point. You know, if you think about it, we really don't see the inside of our nose at all. We see the outside of our nose all the time, but no one knows what the inside of their nose looks like. It's very interesting. So when you come and see us for nasal breathing issues, we use specialized instruments. We may even use a camera to pass inside your nose to see all the way through the back, to literally shine light in places in your nose that have never seen the light before. And we can play it back for you on a monitor to say, hey, this is what we found. This is what's been causing your obstruction this whole time. And we can come up with a plan to treat you. In this case, just remove the chicken bone.
Yeah, and sometimes it can turn into cosmetic surgery as well as a twofer, which insurance usually doesn't pay for, but in this case, it probably would.
Yeah, so whenever we talk to patients about medical surgery to treat an obstruction, we ask them, hey, while we're in there, is there anything else you want to be changed about your nose? Which is a good question, because many people want something to be done. Maybe you just want a bump taken down. Maybe you had an old sports injury from back in the day that you want to be fixed. So that's a good time to discuss those wishes, because we're going to be there in the surgery, and it's very little added surgical time and very little added surgical risk to be able to take care of all those things at once. And when you bundle these surgeries together, not only do you have to go through recovery only once, but by the time you're done recovering, you get a nose that breathes great and looks the way you want it to look. And by bundling those procedures together, it could prove cheaper for you in the long run.
Right. Well, that's Dr. Collin Chen. He knows a good nose. We appreciate it. And once again, we've got more information on our website on SLUCARE Rhinoplasty, and you can find that at Fox 2, the mobile app as well.